Welcome to this educational program. It is our sincere hope that this program will enhance the discussions between you and your physician regarding your condition. This program is not meant to replace these discussions with your doctor, but simply to make them more meaningful. The material in this presentation is independently produced. The mention of any medical product or drug does not imply its endorsement. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendations. This module reviews the methods of evaluating overactive bladder, or OAB. Other modules are available which discuss other aspects of OAB. Each module is relatively short. However, in total, there is quite a bit of material. It is recommended that you take your time viewing one module at a time and try not to take in too much at once. You are welcome to view each presentation as many times as you like. Furthermore, you may pause the presentation or skip through parts of it using the player on your left, and you may view the slides in any order you wish. The term overactive bladder, or OAB, describes a group of bothersome bladder symptoms, which include frequent urination, nighttime urination, urgency to urinate, and leakage episodes or incontinence related to poor control of bladder urgency. At this point, you will already have seen your physician for an initial evaluation. The initial visit typically includes a detailed focused medical history, or interview, and you may also be asked to fill out a voiding diary prior to your next visit. A physical examination is usually performed at the initial visit. However, the exam may be delayed if other testing is planned. Other possible testing includes an assessment of bladder emptying, cystoscopy, and urodynamics studies. We will review each step of the evaluation in detail. During your initial interview with your doctor, you will be asked detailed questions about your condition, including questions such as how frequently you visit the bathroom to urinate, how often you wake up at night to urinate, and how often, if ever, you have bladder accidents with urine loss. It is important to be open and honest with your doctor and to let him or her know how OAB is affecting your life. Usually, nothing more than a simple urine test is required to rule out infection or other reversible conditions. While the most important information regarding your condition can be obtained during your medical interview, a physical examination is often necessary. This may involve a general assessment with abdominal exam and a pelvic examination. Sometimes a brief neurological exam and/or a rectal exam may be necessary. Your doctor may ask you to fill out a voiding diary, such as this sample one filled out by someone with overactive bladder symptoms. Voiding diaries provide valuable information about the severity of your condition, as well as your dietary habits, for you and your physician. This gives baseline information and allows your doctor to follow the effects of treatment. Diaries should be completed before or just after your initial assessment, a month or so after any treatment intervention, and periodically thereafter. It is best to evaluate 2 24-hour periods each time, one on a workday and one on a weekend or holiday. In certain situations, your physician may want to evaluate how well you empty your bladder. These include the presence of obstructive symptoms, a history of many bladder infections, and previous incontinence surgery. Certain at-risk patient groups, such as those with neurological disease, diabetes, and advanced age, may also need to have their bladder emptying checked. Bladder emptying can be assessed by scanning over the bladder with an ultrasound device to measure the volume of urine remaining in the bladder after urinating. This may be done in your doctor's office or in an X-ray clinic. Alternatively, after urinating, a small catheter may be passed into the bladder to drain and measure the remaining volume. This is in fact the most accurate way to measure the volume. Cystoscopy is a quick outpatient procedure which involves passing a small telescope into the bladder through the urethra or urine passage by introducing some freezing jelly into the urethra. These tests are done to evaluate the lining of the bladder to rule out other bladder conditions. During cystoscopy, the bladder can also be filled for evaluation of its size and to assist in the examination of the supporting structures or pelvic floor under the bladder. Urodynamics evaluate the function of the bladder. Urodynamics studies are not required for all patients with bladder problems by any means. Some of the more common settings where urodynamic tests may be requested include when initial treatment, such as dietary changes or medications, fail to resolve the problem, when the problem is complex and a precise diagnosis is required, when surgery is planned or being considered, when problems occur following surgery, and when neurologic conditions are present which may affect the bladder. So what are urodynamics exactly? Urodynamics are a true test of bladder function and provide multiple pieces of information for your doctor. They allow him or her to diagnose the exact cause of OAB and to measure the bladder's size, sensation, and strength while urinating. Obstruction to bladder emptying can also be ruled out. Lastly, these tests are an excellent means of evaluating neurologic conditions which affect bladder function. Typically, a urodynamic study takes about 30 to 60 minutes to complete and is usually done by a nurse or technician. A doctor may also be present for some tests. There are two types of urodynamic tests. Video urodynamics involve the use of X-ray pictures periodically throughout the procedure, while non-video urodynamics do not. During urodynamics, very small tubes are passed into the bladder and rectum. These tubes are then connected to a computer which measures pressure. The bladder will then be slowly filled with fluid, and you will be asked to empty it. This photograph shows a typical urodynamic suite without X-ray. There are many different setups available. The concept of a urodynamic test where small tubes are passed into the body may be intimidating. However, it is important to understand that it is not a painful procedure, and the results of the test are very valuable to your doctor in helping him or her to help you. In summary, for most patients, OAB can be diagnosed during the initial visit. Special testing, which is simple and safe, is required for some patients. Finally, it is important to remember that proper evaluation leads to successful treatment. You are welcome to view this presentation as many times as necessary. When you are ready, we encourage you to access these other modules discussing OAB. You will gain a greater understanding of OAB and insight into most conservative and medical treatments available. For the few patients where medications fail to relieve the symptoms of OAB, a module is available discussing more advanced treatment options. Finally, for those patients referred for urodynamic studies, a separate module is available outlining these tests in more detail. These resources may help you to find further information or support about your condition. This is just a sample of some modern references discussing overactive bladder, available at your local medical library. We hope that this program has given you a better understanding of overactive bladder and how it is evaluated. We wish you the best for the future, and thank you again for viewing this educational program.